name is Wilfred Nyagudi, the Secretary and CEO to the Board of Siaya Public Service. On various dates, we received some allegations about individuals who are purporting to have been recruited by this board and that they were already working in our facilities. So we took an initiative to find out exactly who these people were, because in as far as we were concerned, we were not aware of people who were working in facilities and had not been paid for that long period of time. So we took the initiative to find out by way of authentication and verification of the documents which these people were in possession of. So in that regard, we requested these officers or these individuals to present several documents in their possession for purposes of checking within our systems on how these particular documents could have gotten into their hands. So on 18th and 19th of August 2025, we were able to request of these individuals to bring those documents to us, and a total of 502 individuals brought documents. The documents they brought included appointment letters, offer of appointment letters, deployment letters, and arrival letters, which we collected and subjected to a verification exercise. The objective of this exercise was to examine and verify the validity of the employment documents. We also wanted to establish the process of the recruitment and deployments of these particular individuals. We wanted also to establish culpability, if any, on the parties involved in the process. We also wanted to take necessary action, if any, if an irregularity was to be established. So to this end, we developed a methodology, and we developed a data capture template of the names, ID numbers, and designations of these officers, including when they were interviewed. We did a physical verification of appointment letters to ascertain if they bear the signature of the board secretary, the board seal, reference numbers, and dates of employment. And this, I may say, our letters have got salient physical features that will enable us to know whether they are authentic or not. We also undertook verification of names against the list of applicants as contained in our database. Again, shortlisted candidates. Again, we wanted to check these names against the interviewees list, because when you come for an interview, there must be an attendance, and at the same time, there must be a score that you got out of this interview. And then we also have our list of successful candidates. So you must also have been part of the people who are considered successful. And then we also wanted to verify the authenticity of the board secretary's signature, because some people are good at doing other people's signatures. So as a result of this, we noticed several issues. One of them was inconsistencies on the sequencing of reference letters, such that any letter we issue has got a reference number. So if a reference number is outside our referencing, or that one is a letter that is not considered authentic. Deployments must be signed by the Chief Officer of Health. If they're not signed by the Chief Officer of Health, or is designate, of course, by way of delegation, we also don't consider that as as an authentic letter. So we noticed that during this process, we also had cases whereby there's somebody with a deployment letter that is dated earlier than the appointment letter. So deployment letter actually comes almost at the tail end of the exercise. So you cannot purport that you are deployed in December, but again appointed in January. Deployed in December 2024, but appointed in January 2025. That is not a possibility. So when we're doing the validation, out of the 502 who came, we noticed that 382 did not have letters that originated from this board. 382. That leaves with 120. Of this 120, these 120 were recruited during the regular recruitment process. So as they were reporting, some people took advantage of that process and started generating letters that were not very authentic. So when these 120 were reporting, these people also reporting with them. So we ended up having a mixture of people. That's why in the 502, we have some people without authentic letters. So there was that mixture of that confusion. So be it as it may, we decided therefore to set the record clear by inviting all these people and reading out the names of the successful candidates as contained in our records, as contained in our procedures. So that left now the group that now started complaining. So what did we do when we heard about this in the first time? In the face value, we realized that some individuals did not have authentic letters. So the first thing we did was to report to the DCI to investigate, because they are the people with those powers, to investigate these matters. And we even took samples of those letters for verification by those forensics. And your guess is as good as mine. Yeah, they were found not to be authentic. So with that, we therefore decided that we could have just taken a sample of 5 or 10. We realized that there could be a bigger problem out there. Then we say, you come, we want to see all these things. That's how we were able to get to the 382 that were not authentic. And as a stopgap measure, we've asked the Department of Health that these individuals with questionable letters should not be allowed to work in the facilities. Because should anything happen as they work and they don't have authentic recruitment employment documents, it is both the risk to the government and even to those individuals who are purporting to be working. And again, we've shared the same with the investigative agencies so that they can also undertake further investigations. And then we have also said that going into the future, and this is what has been happening, is just we're just reinforcing it. All deployments must adhere to the list of successful candidates as issued by the County Public Service Board. The Siaya County Public Service Board does not charge money for jobs. Yeah? In the recruitment process, free, fair, and transparent, right? Now, if in the process of recruitment, you feel or you know you give money to anybody, right? And the fact that you are complaining that you gave money means you gave money and still didn't get a job, means that Siaya County Public Service Board does not sell the jobs. So go to the police, DCI, so that investigations can be done, and if that can help recover your money. But I want to tell you, it is a criminal offense touching on both the giver and the recipient on issues to do with jobs in the public service, especially Siaya County Public Service Board. I have not received any letter here of anybody who has made a formal complaint against the board or myself in regards to fraud in the recruitment process.
My name is Emily Nabwala Anyango. I have been, or I want to believe, I have been an employee of the county government of Siaya from January to this moment. I'm in the health department. I am a clinical officer by profession. So my colleagues hapa nyuma, we are in different sections in the health department, and today it has been a bad day for us. Tulikuwa employed in January. Employment, sorry. Employment letters tulipewa in December. Tukakuwa deployed in our various facilities in January 2025. We have been diligent. We have been loyal to our duties. We have been working all the way. We have the probation period here, 6 months, of which within the 6 months, various activities have to be confirmed for us to be confirmed into the system. And in those activities, kuna confirmation of documents, if you have the right documents, if you are legally recognized, say by your council or by your various bodies. Hizi zote zimetendeka. So tumekuwa tukifollow up with our employers about the processes. Wamekuwa wakituambia just be patient, we are working on it. Tunasukumwa, deadline inasukumwa mbele, next week mtapata feedback. Hiyo wiki inafika, we have nothing to show. And all this while, we have not received any salary. We have not been told that we are not qualified to work in that county. Head count ilifanywa in March. We wonder how long does it take to verify results za head count if indeed I am an employee of the county or not. Sometime in August, after pressure imemount, tukaambiwa you bring your documents, we want to do verification tujue if you are legally employed or not. So tumepeleka documents. It has taken another 1 month of us going to work and coming back home with no money. And each time jo wezi miss job because utaulizwa why are you not at work. They don't want to know how you're going to work. Hawajui tunaishi na madeni. Some of us have families, we have kids in schools, so tuko na madeni from school fees to our transportation buddies. Like, how do we survive? Alafu sasa leo, we had booked a meeting with the governor, tukaambiwa tukuje today. Unfortunately, he left before we arrived. Na tukaambiwa, now there is a list out of 502 people that were employed in the Department of Health. Only 120 have qualified to be employers. So the rest of us, 382 people, tumeambiwa, oh, don't go to work. Just like that. How are we getting compensated for the 8 months? This is the 9th month that we were working diligently in our facilities. And which criteria have they used in absorbing the 120 that we cannot qualify? Like, what is special about the 120? we have also been working. So tunataka tu kujua, some of us tumekuwa transferred from one facility to another. Tulikuwa tunakuwa transferred on which basis? Like, were we volunteers? Tumekuwa transferred from even 3 times. Others were given responsibilities. Others were given in-chargeship responsibilities. Others were given posting orders. Tumekuwa kwa posting orders. Fulani, you have been posted to this facility. So tunashangaa tu hizo posting orders zilikuwa zinatoka wapi? Do we have a different county in this county that we do not know about? Hiyo ndo kitu tunataka tujue, because now 9 months of working, no money. Unaambiwa go home. What next? I need my job and I need the pay as well.
I'm Omondi Felix. I work at Ligega Health Center. I've been working there for now this the 9th month, and I can say that it has been hard. We work, we don't get paid, we have nothing to live for. We were just there. Nobody wants to know how you live. Nobody wants to know why you can't miss the job. So the same scrutiny, just the same as the other guys. We've been working hard to lend money just to survive in such harsh situations. Because how do you survive without being paid? You pay rent, you pay school fees, and at the same time, you have to dress well and smile for the patients. We've been doing the same, just like other employed candidates. So we've been wondering what is happening, what will be happening to us now. Should we go home and tell our families that we have no job now? Because we've been there, they know we've been working, and actually they've been looking forward for these salaries so that we can pay our debts. Some other families have been followed by our friends who lended us money. We've been working here, eating money that we've been lended by friends. So we've been lent money to work, and we need that salary or that compensation to pay back that debt. So we are urging our county to look to work on this so that they can find a way to sort us. We need that help. We need that job. We seriously need it, because this is what we deserve. We actually deserve it because we qualified for it. Everything was right with us until now that we are now told we are not one of them. So we are wondering where were we? Were we not there, or where were we? Some hospitals are running just on our services. We work and the county gets what they deserve. That's why we also get what we deserve. We actually need what we deserve.
One two iko sawa.